Hello, if you're an owner, operator, or a key team member in a small clinic that serves rural populations or want to serve rural populations, this video is for you. I'm going to be telling you how you can use the Rural Health Transformation Programme to expand your funding, expand your brand, expand your workforce, and ultimately expand the number of patients and clients that you serve. So let's start number one, expand your funding. If you haven't heard about it, the Rural Health Transformation Programme is a $50 billion federal fund that's going to be distributing on average $1 billion to each state health and human services agency to then give out to healthcare providers which serve rural populations. This is a generational opportunity to take advantage of federal funding to transform and grow your rural practice. Why is this important? Well, it's hard to come by money in rural, as I'm sure you know. This is an unprecedented boost cash injection into the system. I think it's crucial in this first year of the fund, financial year 2026, you take advantage of it. You keep on top of what your state is doing, look out for any RFPs, engage your state agencies, engage other partners so that whenever RFPs come out in your state for grants, you're the first one to apply. You're probably wondering, well, how does this serve me? I'm focusing on the outcomes here. How does this serve you acquiring and serving more patients? Well, part of this program, well, really all of this program, is to improve healthcare outcomes in rural areas. That's the end. Now, the means are through technology innovation, workforce development, through EHR, telehealth. There's a lot of different ways that CMS have mandated this to be played through, but ultimately, they want to get more care, better care out to rural populations. And I think that's where you come in. Even if you're serving a small group of people or you're not serving a rural community at the moment, depending on your state, there is hope for you. There's hope that you can bring your great work to new populations who are in remote or frontier areas, and that's what CMS wants to fund. Now, how do you do this? Well, on the brand front, CMS are looking to what they're calling Make America Healthy Again. This is to improve nutrition, improve dietary choices, improve exercise choices, and tackle substance use disorders, etc. You can get yourself out there into rural areas and rural communities by helping doing this. Create a campaign that educates people on nutrition, do a workshop or a program in your clinic. And what that does is, number one, it does help teach those people how to look after the health better, but it also brings people into your network, into your circle. People become aware of you. And in a sense, it's marketing for your organization too. Nobody wants to spend money on marketing. Nobody wants to spend time on marketing, but you can use these funds to do activities that engage your community, educate them, and it's kind of covert marketing in a way because they're coming in the door, they're seeing you, they're knowing you, they're liking you, they're trusting you, and it's a way to get them to come to you for healthcare in the future. Now, the second point that I wanted to make was on expanding the patients and clients. How do you do this? Telehealth. You might have a telehealth option at the moment, but if you don't, this is a perfect program to fund it. So you can use the money to install a telehealth system, get the hardware, get the software on board, get the team trained, and then promote that opportunity to people who are either in your rural areas that are near you, in rural areas that aren't near you but are not covered by clinicians or anyone really, they're in a sort of healthcare desert, or indeed your own community who are nearby you but aren't currently using telehealth. There's a lot of ways to use this fund to get online and expand what you're doing. And if you're already online, I wouldn't stop there. So we did a campaign in Western Colorado in 6 rural states to tell people, hey, telehealth exists and you can use it. You'd be really surprised at the number of people that were interested. And we got thousands of impressions reach and hundreds of people clicked it and telephoned the helpline that we set up to say, I didn't know about this, or maybe I didn't trust what this was all about until I saw the ad. There is still a kind of communication gap on telehealth. So even if you're currently doing it, you can use these funds, depending on your state again, to go out to new areas, tell people about your telehealth practice, and then bring them into your pipeline. Now, if all goes well, you might be thinking, well, I've got extra work. How do I serve it? Well, that's where workforce development comes in. So you can use these funds, depending on your state. Again, I keep saying that because every state is going to release something different, so you have to keep an eye on it. But in Alaska, for example, we're expecting that funds are going to be available to recruit people into could be peer support specialist positions, mental health therapist positions, certification programs. I know traditional health workers is a big one, traditional health aides too. There's going to be a lot of opportunities for you as the expert or your team to train new staff who can come in and fill. It could be a telehealth opening, or it could be an actual in-person physical frontline healthcare opening. You can also use it to recruit staff who are currently up at their positions and licensed, such as doctors and nurses, get them relocated into the area. Although that might be a little bit of a trickier and longer play, you have to kind of use the money to give it as incentive bonuses. They have to stay for 5 years. I think it's good to target both. Think about how you can bring in entry level people, train them up, use this funds to maybe partner with local education providers to give people bursaries, etc. And indeed, get campaigns out there to engage people that aren't in your community. Maybe they're in the city or town nearby, bring them in, and then that will expand your clinic. So we're really excited about this, and most of the people that are responding to us are actually smaller clinics. It's a great opportunity potentially for many of you to expand your funding, expand your workforce, expand your client or patient base through telehealth, and then make people know more about what you do through providing value, providing education, and ultimately improving public health across the board. So if you want to learn more about how you can expand your clinic or behavioral health practice, reach out to us. You can look up the Rural Health Workforce Transformation Hub. You can reach me on LinkedIn, Adam Chambers, or reach my partner, Michael Fitzmaurice, well, Dr. Michael Fitzmaurice, I should say, who is fielding a lot of questions on this and helping connect people with funds and create programs that will ultimately improve the outcomes of rural communities that you currently serve or could serve in the future. So that's all from me. Have a great day, and thanks for watching.